This discussion is about psychoanalysis as being theorized and popularized by Sigmund Freud, 1856 to 1939. Psychoanalysis is a specialty in psychology and a clinical method of treating psychopathology. An investigation of human mind, and this is being carried out by creating a dialogue between a patient and the psychotherapist. Simple as saying, this is a method of treating mentally ill patient. Likewise, or at the same token, it is an approach to the theory of personality and psychotherapy, a philosophical view of human nature. For us nurses, this is an approach to understand the dynamics and theories of personality. That's why this week's discussion will be all about the basic concept of personality, as well as its definition and the multiple theories of human development together with personality development. We will include the broad concept of multiple theories, such as the psychosocial, the psychosexual, the cognitive learning theory, the moral development, the interpersonal theory. For nurses, it is a must for us to acquire the right knowledge and skills. This is for us to carry out our duties and responsibilities because we will be dealing with various personality, dealing with different perception, different attitudes, different emotions, even a unique personality. Welcome to psychoanalysis and welcome to the basic concept of personality. The psych level of awareness, or the level of awareness of our mind. The psychoanalytical theory dictates that the human behavior can be explained together with its causation. And Freud illustrated this by showing to us the analogy of icebergs, which you are seeing right now at the right side of the slide. You may notice that from the water level up to the tip is a floating area. And from the level of the water down to the bottom or base of the icebergs is a submerged area. And this is further explained by arriving at a 3 level of consciousness, from which the topmost layer, from the water level to the tip or apex, represents the conscious level, where your thoughts, your perception, and logic are being expressed right at this moment that you are listening. The moment that you are aware, the moment that you are conscious about your thoughts, your feelings, and emotions. Down below the water level is what we call the pre-conscious or the subconscious level. This is where your values, your ideas, your morals, and your memories are being kept. The facts that are stored in your brain but are not in the present level of awareness. However, those values, morals, ideas, and memories can be retrieved at some efforts. And the typical example stated here is that if right now somebody asks you as to where your address is, you can immediately tell that, and a possibility of retrieval is there. Down from the low level of preconscious to the bottom of the icebergs is what we call the unconscious level. Unconscious level is the realm of thoughts and feelings. That means if you have in your mind those stored information, and those stored information can either contain the fears that you have, the violent urges in you, those selfish needs, those jealous feelings, those feelings of guilt, those needs for self-love. These are in the unconscious mind. And Freud believed that much of what we do or what we say is being motivated by the preconscious and the subconscious. Meaning, the preconscious and the subconscious are the reflections of our personality. Freud further believes that if we have a repressed feeling, that means the feelings of desires, those behavior like the sexual drive, those violent urges, those unresolved feelings like the childhood trauma or the childhood failures, the conflicts, those inability to accomplish the task when you were young, those traumatic or even the painful event in your life are being repressed in your mind. That means it is being kept and locked at the back of your mind. And this unconscious feeling is said to be shaping and defining your personality right now. Further, if you may notice, the iceberg's analogy shows a metaphor that the biggest, the huge, and the bulk size of the icebergs is being carried on by the preconscious and the unconscious. And whether we like it or not, this unconscious part will continue to influence our behavior even if we are unaware of that. And this is the explanation of the iceberg's analogy representing the level of awareness of our mind. We will continue with the next slide. The personality components. Freud conceptualized personality structure as having three components. And these are the id, the ego, and the superego. Let's first talk about the id. Id is said to be basic, primitive, and innate desire. That's why this is represented by, looking at your right side, it is represented by the devil. This is a part of us saying and making us illogical, irrational, and fantasy-oriented. This id operates on a pleasure principle. That's why we always wanted to gain pleasure and avoid the pain. This is a part of our thinking that we become aggressive and having the sexual urge. This id always wanted gratification right now, right here, and this is very impulsive. It is a part of a human mind that is considered to be biological component. Now let's talk about the ego. As you may see, ego is a rational level of personality that operates from the reality principle. And if you will look at the middle or the caricature, this is having a logical thinking. That's why it tries to look at his left. It is mature and adaptive, and this ego can be present in all. Anxiety will result if the ego cannot mediate or cannot balance the stand of id and superego. If id is a biological component, then ego is a psychological component. And finally, the superego. The superego is being represented by an angel, contrary to the id, which is a devil. This happens when we are partially conscious, unconscious. The superego operates on a moral principle. It always tries to look whether his action is ethical, legal, and based on the norms of the society. By the superego, we are able to differentiate between good and bad, right and wrong. And if we will be able to follow this, then the superego will be proud. But if not, there will be a feeling of guilt and anxiety. Id is a biological component, while ego is a psychological, and superego is the social component. As an analysis, it can be drawn that from the personality component being laid down by Freud, we can say that these three components interact with one another and that they will form a whole. They operate holistically rather than individually, and that they all contribute. The three of them really contributes to the individual behavior. That's why our behavior is being formed by the interaction of all these three. Although there is a conflict that normally exists among the three of them, the ego is always trying to mediate or trying to balance by eliciting what we call the defense mechanism. And that will be the topic of our next discussion. This is about the defense mechanism. What do you do when you encounter a failure? Like maybe a breakup or a failing grade by missing a deadline, either a loss of a job or the pain of being rejected or by being bullied. Are you going to confront the situation or are you just going to learn from it and try your best to move on? Well, regardless of what would be your choice, your ego will have to carry and experience the hurt and impact. But sometimes our brain has a plan for us. Without our knowledge or consent, the brain may deploy what we call the defense mechanism. And this will allow us to deal with the bad situation, well, at least for a while or temporary. Defense mechanism is a psychological strategies brought into play by the unconscious mind to manipulate, deny, or distort the reality in order to defend against the feelings of anxiety and acceptable impulses to maintain one's self-schema. Our brain is doing the defense mechanism in order to cope up with unbearable thoughts, feelings, and wishes. It will protect our personality from emotions and self-esteem. It will reduce the impact of physical pain. And I have devised a code, same. The following are the list of ego defense mechanisms, further classified into three. The first one is what we call the primitive. It is the first to occur developmentally. It reduces the tension to a lowest possible point. The list below are those primitive ego defense mechanisms that is considered to cause the death instinct. That simply means it is inwardly directed as self-destructive, but then later on it will turn outward as an aggressive defense mechanism. The opposite would be the matured defense mechanism. This kind of defense mechanism is to be healthy and is consciously related with reality. There can be an uncomfortable thoughts when using this matured ego defense mechanism, but deliberately it will lessen the threatening situation. And the less primitive are the following lists, which are considered to be midway between the primitive and the matured. Denial. This is the failure to acknowledge an unbearable condition. And there are three situations that you are about to see. The first situation is a diabetic child who is trying to eat chocolate candy instead of her condition. The second condition is a patient who have a cancer being revealed by the doctor, and yet he is trying to ignore the doctor's revelation. And the third situation is a guy who is already broke, but yet he's trying to spend more money freely. Now, with all the three situations and conditions, there is an unbearable condition. One is with diabetes, second is with cancer, and the third is a person who's broke. They all fail to admit the reality of the situation. They are trying to deny as a defense mechanism in order for their ego to maintain. And they do enable the problem to continue. This is a primitive defense mechanism called the denial. The regression, it means moving back to a previous developmental stage just in order to feel safe or have needs met. A typical example is a 5-year-old child who asks for a bottle when new baby brother is being fed. That simply means that the child feels an envious stimulation and that he needs to satisfy again his oral gratification. And another typical example is that of a man who pouts his lip or who thumbsuck like a 4-year-old upon knowing that he is no longer the center of his girlfriend's attention. And these both examples are very primitive. They both wanted to return to an earlier developmental stage in order to release the tension or to lower the possible building up of tension to themselves. Dissociation. This defense mechanism requires a temporary alteration in the consciousness or identity of the persons involved, because this dissociation deals with emotional conflict. And one of the typical example is a person who suffered from amnesia that prevents him from recalling the yesterday's auto accident. And the second illustration is about an adult who remembers nothing of a childhood sexual abuse. Now, the first incident is a memory alteration of a tragic accident causing confusion of severe memory disruption, while the second scenario is an unresolved, sorrowful, childhood bitter, unbearable memory. While both scenarios demands that it should reveal an intense mental conflict and resolution, even for temporary. And this is what we call the dissociation. This is projection, the unconscious blaming of unacceptable inclinations or a thought of an external object. Our first example is about a man who wants to condemn a same-sex gender relationship. He's pointing his fingers at those who are gays. But he himself is projecting it to others while he himself is a gay. And the second example is a situation where there is a person who has a lot of prejudices, yet he himself is a bigot. Projection is easy to remember. If you just see those fingers pointing to others, then he is referring to himself, trying to hide his real feelings, and that is projection.